Nick Ferrari now. 0345 6060 973. LBC. You can sell your Ferrari at breakfast on LBC. Call 0345 6060 973.
9 minutes before 8 is the time where the government seems to be wresting back control of COVID and certainly the vaccination programme as regards care homes. And we'll have more on that in a moment with Care Minister Helen Whately and Conservative MP who joins me. Just first, Minister, thank you for coming on the show. There's a very live conversation now about possibility of vaccinating our teachers. This comes as a report shows that a so-called lost generation will be hindered through their entire schooling and indeed educational careers. Where are you on the idea that teachers are moved up the cohorts? Good morning to you.
Well, I mean, I absolutely want to see children back at school. You'll know the government was really reluctant to close schools. It was the last thing to close. We said they'll be the first thing to open. I have 3 children homeschooling at the moment, and believe me, like parents across the country, want them to be back at school. I've also spoken to teachers who themselves said they want to be vaccinated. I totally understand that. I mean, as you'll know, as your listeners will know, we are following the JCVI prioritisation of vaccinating first those who are most at risk from the virus, most at risk of dying from the virus. That's why we're vaccinating these priority groups 1 to 4 by the 15th of February, and then following through the others who are most at risk. That is the approach that we're taking to use the vaccination to save lives.
Yes. You didn't actually answer my question, Minister. Would you support the idea, though, of moving teachers up the cohorts?
Well, I absolutely want to see us vaccinate teachers as and when we can, but I think it's actually
so you're not in favour of moving them up then?
Well, I think what I'd say, and I know that, and to those campaigning on this is you have to think, well, who are you going to delay the vaccination from in order to move somebody up the list. So that's a really, really difficult question that you would have to think about, given that at the moment the order that we're following, say based on the JCVI prioritisation, is based on the order in which is set out to save the most lives.
Let me ask you this. It's a tremendous day yesterday. There were nearly 600,000 first vaccinations, 588,000. But some days last week it was at 230,000. Are there supply issues? How come it's jumping up and down so vividly, so dramatically?
So I think what you'll know, and it's been said many times, is the limiting factor has been on supply. And as deliveries come through, then vaccinations ramp up. So I know, for instance, for care homes, where we've now gone into over 10,000 care homes to vaccinate the residents and many of the staff, a lot of those, the latest tranche of those vaccinations happened Wednesday, Thursday, Friday, Saturday, even yesterday, to vaccinate in those care homes as deliveries of the vaccine came in. So it's the supply that's been the big factor there. But as you say, on Saturday, we saw almost 600,000 people being vaccinated. We've now vaccinated 8.9 million people. This is a huge share of the population. In fact, we've vaccinated over 90% of the over 80s, so some of those who are most at risk of this virus, which really puts us in a much better place.
A couple of the headlines suggest that there's been a victory in care homes. All residents have been provided or offered the jab. Is that how you understand it to be, Minister?
Well, I don't write the headlines, but what I will say is this is a huge moment for our care homes. I mean, some of the scenes that we've seen in care homes of people literally in tears as they get their vaccination, because this at last is some form of defence, some form of protection against this virus. So what we've done, as I said, that we've got into over 10,000 care homes for those looking after older people, those most at risk. We have offered the vaccination to all care homes looking after older people. There are, you'll have a small number of residents who might not be able to have the vaccination. They clearly need to give consent, and there's a very small number, I'll say, where there have been recent outbreaks, and the local public health said.
Well, that's what we see as you speak. That's what's happened with a particular residence in Yeovil. Sadly, there has been an outbreak there, so they're on delay. But it's your understanding that everybody has at least been contacted, and once they're out of the isolation period, then the relevant health authority can move in. That's how you understand the position to be, is it, Minister?
Yes, absolutely. We've contacted, and actually I made sure that we've contacted a big outbound communications effort twice over the last couple of weeks, saying if you haven't had a contact from a vaccination team, here's the email to contact us and let us know, so we can literally go in and identify care homes that hadn't had a visit. So I really am hearing that care homes have had that contact. As you say, a small number where there's a particularly outbreak situation.
Yes.
Haven't, and who will then have their vaccination as soon as they can. But actually, even care homes that have got outbreaks have been vaccinated where it's possible. I know of one where they've got an outbreak, but there was one resident who could have the vaccination, and the team has gone in and vaccinated that one resident, and will go back again when they can do the others. Well,
that's tremendous. Now, what of this report that suggests, so that's the care homes, Minister, housebound patients, elderly housebound patients have slipped through the cracks of the programme. What can you tell us about that, Minister?
Well, I know that my colleague Nadim Zahawi, who's been doing such a brilliant job driving this vaccination process, and NHS England, the GPs, there are thousands of people involved in this, are absolutely aware of the extra challenge of getting to vaccinate people who are housebound, but they are working on doing that. As we said, we want to offer the vaccine to all those in priority groups 1 and 4 to have it between now and but by February the 15th. But I'm sure we are on track to do that.
But for someone who is housebound, Minister, what is the programme? How do we get the jab to him or her if they're housebound?
I know that there are people going to people's houses to vaccinate them if they can't get out to a vaccination centre. So, because we are well aware, and I know because some of those who are housebound will be receiving home care from social care workers, that those are really important group of people.
I don't want to rain on the parade. It's fantastic what you've achieved in care homes. It really is. But when you hear from the chief executive of an organisation called, I'm going to call it SERA, it might be KERA, which provides care for around 10,000 vulnerable people, they're estimating it's about roughly only about 100 had so far received their jabs, which is a very low percentage, obviously. That's work to be done, is it not, Minister?
So I saw that report from Sarah.
Is it Sarah? Thank you.
Well, that's how I know them. I saw that report last week, and actually, no, I was in touch with the vaccines minister to say, no, let's make sure that we're really on this, because we're determined to make sure that we vaccinate the vast majority of people who are at greatest risk from this virus by mid-February, because that's really important, as then for us to be able to take the next step and hopefully reopen schools, as we were talking about earlier.
Got to ask you before I let you go, Minister, a word on Cap Hero, Captain Sir Tom Moore, who, of course, fortunately, we understand is in a regular ward. He's not in ICU, but obviously he's an elderly gent and he's battling coronavirus, Minister.
I know it was such sad news to hear that he had gone into hospital after he raised our spirits with his tremendous efforts last year. It's my thoughts are with him, his family, and really hoping that he makes a full recovery.
Grateful for your time. Thank you very much indeed. Care Minister Helen Whately appearing here on LBC. We're at 8 o'clock. News is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, the NHS claims coronavirus vaccines have now been offered to all eligible care home residents in England. The Prime Minister says it marks a crucial milestone in the ongoing race to vaccinate the most vulnerable against COVID-19. But some homes haven't yet been visited because they're dealing with outbreaks of the disease. Boris Johnson also insists the government is not concerned about vaccine supply after the EU briefly threatened to block exports in a row over deliveries.
It's crucial for everybody to understand we're very confident in our supplies.